After 12 Central African time, and we're coming to you live from Johannesburg in South Africa. The offices of Save the Children in South Sudan's eastern Jonglei state have been looted and burnt down, and a healthcare center has been destroyed. Escalating violence has displaced over 235,000 people. To tell us more about the situation in South Sudan, we are now joined on the line by Chris Nyamandi, a country director for Save the Children in South Sudan. Chris, good afternoon, and thank you for joining us on Africa Update.
Thank you. Good afternoon, and good afternoon to the listeners.
Chris, I mean, this is devastating when you just think about it, and what the people of South Sudan have been going through for a number of years, and now this, where it's a case of a healthcare center being destroyed. Now there are, what other facilities are there for the people who are still there to get assistance medically and just, as Save the Children? What does this mean going forward?
Yeah, so thanks a lot for that. I think this has been a very difficult situation here in South Sudan. The locations that we are talking to are places where the entire health system is provided by international and national non-governmental organizations. These are places where people have been running away from conflict for a long time. There's been flooding, and so health facilities have been attacked, have been bombed, burned down. So really difficult situation for children and mothers who are trying to fend for their children. So we are really appalled by the situation. And right now our focus is on trying to stabilize the situation and giving assistance to our staff who have also been displaced because of the ongoing fighting.
We understand that all operations have been suspended. How do you then start? Because it's basically going back to the starting point and the waiting periods of getting more supplies, especially just to think that once you do get more supplies, are they going to be looted again? What is the plan of action going forward?
Yeah, so this is our concern. Our concern is that the health system generally has always been fragile. We depend upon the dry season to pre-position stocks. We have been investing in trying to build new facilities, rehabilitating facilities. So when those investments are destroyed, it really becomes difficult, especially in this environment where we have to talk to our donors to get additional funding. So to go back to the same donors to get funding will really be difficult. This is why it is appalling in this environment that we have to start again afresh. But look, we are talking about the lives of children, the lives of women who have done nothing wrong except to be born in these areas, and who depend upon the work that our aid workers, not just for Save the Children, but from other organizations, also do. And therefore, we are committed to continue to work in those locations, but we can only do so when both parties to the conflict can assure us that our staff are safe, our assets are safe, and we can do our work without fear of repercussions.
With all of this that's happened, we understand that 4 of your vehicles were seized last week. Tell us about this and why you are not getting support or assistance when it comes to both parties to this conflict.
We have had assurances that those vehicles were going to be returned because they were not seized by an unorganized criminal group. They were seized by an organized armed group. So our conversations with the authorities were pointed to the possibility of those vehicles being returned. But now that the entire town has been burned down and our offices and health facilities have been destroyed, we are unsure whether we will be able to recover those vehicles. Look, the vehicles that we are talking about are vehicles that we're using as ambulances to transport patients from one location to another. We had a tractor that we were using to ferry supplies. As you know, in these locations, especially during rain season, the infrastructure is so undeveloped that we can't move from one location to another unless if we have a tractor, for example. We're talking about vehicles that we were using to transport doctors and nurses to go from village to carry out vaccinations and provide health assistance to communities. So our work was already paralyzed by those assets being seized. We hope that we'll be able to recover them, but it's discouraging at this moment that despite all the assurances that we've received, that our assets were being targeted in this way.
Mhm. Now, Chris, apart from what you're facing now with the looting and the burning and destroying of healthcare centers, it seems that the violence is also exacerbating a cholera outbreak. Could your suspending operations also add to this? And is there any way to help the people?
Yeah, so the cholera outbreak has been recorded in counties that are very close to where the violence is happening right now. And we believe that if the situation continues to be unchecked, there is going to be further deterioration and the number of cases are going to increase, which is difficult, especially for children. As you know, in South Sudan generally, over 2 million children are already malnourished. They are not eating enough and they are stunted and they are losing weight because of a lack of food. And so if you add the dimension of a cholera outbreak on top of that, it means that some children are going to die because of the complexity of having to deal with malnutrition as well as an infection. So it's grim. We we hope that the violence subsides. I mean, we know that regional players are calling for an end to violence and a return to dialogue. We hope that that happens so that both the government and international humanitarian organizations can provide assistance. Otherwise, if we are not able to do that, there's going to be a worsening of the outbreak. And we know for sure that the cholera outbreak right now has killed some people, and we are going to see more people dying needlessly because of a lack of assistance.
Médecins Sans Frontières have reported that a number of aid workers are missing after a hospital they run was hit by airstrikes. What information do you have about that?
So this is appalling, and this is not the first time that airstrikes have been hitting medical facilities. I started working in the humanitarian field in 1998, and I recall that in those years, um, spaces like hospitals, um, aid workers' convoys, and aid workers' facilities were considered sacrosanct. And unfortunately, now in 2026, we see an erosion of humanitarian space, including targeting of aid workers. And it's appalling. We know that other NGOs, including MSF, have struggled with this issue. We, as the children, we provide basic medical assistance, and we depend upon MSF to refer children with complicated cases and people with complicated cases, including war injuries, to MSF hospitals. So when those hospitals are damaged, it actually harms the entire health system that we've been trying to build and assist. And so it's a really difficult situation that civilians in South Sudan are facing.
Chris, we have run out of time, but I have to ask you say you've been working in the humanitarian, sector, for lack of a better word, since 1998. And I can imagine on the mental side of things, what it does to aid workers who are willing to give themselves off to be on the ground in these volatile regions, and also having to go through incidences where their lives are put at risk. And how do you work around this as individuals and as aid workers?
Mm. So right now, I have 20 staff members we have been displaced from a town where they were providing assistance, and they are now in villages that are around that town together with their families. We've been able to talk to them. They are of course distressed about losing everything, including their homes and their private properties. And it's unfortunately the situation of aid workers. Save the Children provides mental health support to all our staff, and we are trying to provide not just mental health support but also food and medicines to them. But again, it's not easy when there is no access to those locations. So really, it is what it is. I'm grateful that our organization stands with our aid workers. This is easy for us.
Chris, thank you for making time for us, and all the best. Thank you for joining us on Africa Update.
Thank you so much, Lulu.
That's Chris Nyamandi, country director for Save the Children in South Sudan, joining us on the line. It is 12:32 Central African time, and our news headlines up next.